Hi, my name is Brooke Krolchek, and today I will be discussing propolis produced by Western European honeybees used in treatment of type 2 diabetes. We will start out by identifying our model organism, Aphis mellifera, more commonly known as the Western European honeybee. It is native to Europe, Asia, and the Middle East, but more importantly to us, Western honeybees are not native to the Americas. However, the Western honeybee is essential to pollination of crops in the United States. They are responsible for pollination of many types of fruits, vegetables, and nuts. The Western honeybee also, of course, produces honey. So what exactly is propolis? Propolis is a thick resin-like product made by honeybees. It is essentially just a honeybee product, much like honey, beeswax, and royal jelly. Chemically, propolis is composed of 50% plant resins, 30% waxes, 10% essential and aromatic oils, 5% pollen, and other natural substances. Honeybees use propolis for the construction of their nests. They will use propolis to plug holes, smooth walls inside the nest, and cover any dead organisms so they don't decay inside. Propolis also provides protection to the hive because of its antiseptic and antimicrobial properties. There are two major categories to know when talking about diabetes: type 1 and type 2 diabetes. Type 1 diabetes is caused by the inability of the body to produce insulin. It is an autoimmune disease that prevents the pancreas from producing any insulin. Type 2 diabetes can be caused by genetic factors such as insulin resistance or environmental factors such as obesity, lack of exercise, and stress. Diabetes is categorized as type 2 when the pancreas cannot produce enough insulin or the body does not react to the insulin that is produced. This is a metabolic disorder usually characterized by increased blood sugar. Here are some important terms associated with type 2 diabetes. The first is glycemic parameters, which are used to determine swings in blood glucose levels. Hyperglycemia is high blood glucose, which is commonly associated with type 2 diabetes. Serum glucose is just another term for blood glucose. And fasting plasma glucose is glucose levels when nothing is had to eat or drink. Considering the benefits propolis provides for honeybee colonies, I will be investigating if propolis can reduce blood glucose levels in individuals with type 2 diabetes. The first study will focus on glycemic parameters associated with type 2 diabetes. In clinical studies of the effects of propolis on symptoms of diabetes in patients that ranged from 20 to 85 years old, propolis was found to improve the innate immune response, which is responsible for inflammation. Propolis has anti-hyperglycemia properties, and when administered in different doses of 300 to 400 milligrams, propolis aided glycemic mediators. You can see in the mode of action section of this table for the top 3 rows and the 5th row, which pertain to type 2 diabetes, propolis was effective in modulating glycemic parameters, modifying glycemic control, decreasing serum glucose, and providing glucose metabolism. In study 2, participants with type 2 diabetes were given a variable number of propolis capsules daily. Other variable factors in this study include participants' gender, length of study, and dose of propolis in each capsule. This study aimed to determine the effect of propolis on both fasting plasma glucose and fasting blood sugar. Many of the studies with high daily propolis intake showed significant reductions in fasting plasma glucose levels, as seen in the outcome measures column of the table. Abbreviations for this table are also listed at the bottom. In study 3, researchers wanted to determine the effects of propolis nanoparticles on blood glucose if injected. It is important to note that group 1 and 2 or the dark blue and red bars on the graph were control groups, so they will show slight or no changes. The two groups will be focused on are the last two bars on the graph, or the light blue and orange bars. Both of these groups were treated with Propolis nanoparticles starting at week 1 until the end of the 4 weeks. Both of these groups had a 3-fold reduction in their blood glucose levels after the treatment period was complete. When ingested by capsule, Propolis was deemed effective in the reduction of inflammation, as well as initiating glycemic control for a reduction of serum glucose levels. The treatment of Propolis also showed improvement to glucose metabolism. Significant reduction in fasting plasma glucose was seen when introducing Propolis capsules daily. When injected, Propolis was found to significantly reduce blood glucose levels within a 4-week period. The antioxidant characteristics of Propolis have proven to be extremely beneficial. Studies done on the medicinal uses of Propolis are somewhat lacking. This is due to incidents of asthma or anaphylaxis caused by bee products. Many people are unaware of any bee allergy until they are stung or exposed to a bee product. This factor makes conducting research more difficult. Much of the research that is being conducted produces varying results. This could be due to different doses of Propolis or different locations that the Propolis is collected from. Propolis is being used in research for not only diabetes, but is being looked at for treatment of various other chronic diseases. Propolis could have a big future for medicinal uses.